Well, hey guys, in today's video, I'm going to be reacting to this subreddit Accutane post, the Accutane Starter Pack. I thought I would go through this collage that they put together and give my opinion on if this is good information, is it misleading? You know, there's a lot of misinformation on the internet about Accutane especially. So let's go through it together. But if you're not familiar, what is Accutane? Accutane is a name for the drug isotretinoin, which is for acne, and it's a retinoid that is taken by mouth, and it works very well and in many cases can cure acne for a lot of people. But it does come with side effects. And the first thing that I see on this collage is arguably one of my favorite skincare products, Vaseline petroleum jelly. This is a great recommendation for anybody going on Accutane to keep with them. Petroleum jelly, and it effectively reduces water loss out of the skin. Why is this going to be helpful for you if you are going on Accutane? Well, Accutane is going to dry out your skin quite a bit. It's going to leave your lips incredibly chapped and peeled. I see they show an image here of chapped lips as well, kind of going alongside that. It'd be nice if they had positioned it next to the Vaseline so people kind of made that connection, because Vaseline is really great for the chapped lips piece of Accutane. If you are going to go on Accutane, expect to have dry skin and dry lips. Why? They're expected to happen in everyone who's taking the medication, and they speak to the underlying mechanism of Accutane. If I don't see these things happening, then the person, that suggests to me the person's not taking the medication or it's not being absorbed properly. Anyways, Vaseline is a great recommendation, not only for the lips, but for the skin. Especially people really develop a lot of dryness on the hands. So using Vaseline on your hands and then covering them with white cotton gloves, I highly recommend doing that before you go to bed at night. If you are on Accutane, it really can help quite a bit with the dry hands. All right, I'm also seeing artificial tears. That is a great recommendation. You're going to experience dry eyes on Accutane because Accutane reduces the secretions of the sebaceous glands. You have a type of sebaceous oil gland in your eyes called the meibomian glands that help keep your eyes lubricated. And the Accutane is gonna affect those, and it's gonna give you dry eyes. So much so that if you wear contact lenses, you may not tolerate them. Accutane actually can affect your vision while you are on it, and specifically it affects your night vision. You can have decreased night vision. This is called nyctalopia. It happens because the Accutane isotretinoin, it competitively inhibits retinol dehydrogenase in the eye. That leads to decreased production of rhodopsin, and that is why you have slightly impaired night vision while you are on it. It's not a permanent thing. I always suggest people not drive at night while they're on Accutane, or have somebody drive for them for that reason. You may also have increased sensitivity to glare, and you can have slight changes in perception of colors. The other thing that can happen is your mouth is going to get very dry as well. Inside the mouth, you can experience dry mouth. So they have this giant jug of water there. I think that is what they are getting at with the water. Having water close by, taking frequent sips of water can help minimize the dry mouth symptoms. Another way to manage the dry mouth is to keep some sugar-free lozenges that you can suck on throughout the day, or some sugarless gum to chew on, just to stimulate saliva and to moisten the oral mucosa. So you're not having to chug so much water. They do show that big water jug there, and I'm assuming it has to do with the dry mouth. But I want to clarify, in case this is what they're getting at, that the dry skin you will experience on Accutane is not going to be relieved simply by drinking more water. That is kind of a common myth. Oh, my skin's really dry, I need to be drinking more water. When it comes to the dry skin, Vaseline, like they're showing here, that's key. That's gonna be the key piece in managing your dry skin, not drinking a ton of water. In addition to the Vaseline though, be very mindful of how you are cleansing the skin. You don't want to be bathing too frequently. You may have previously been one of those people who washes your face twice a day. Accutane may not allow you to do that anymore. You may end up only being able to wash your face once a day. And for many people, I actually suggest while on Accutane to just use water to rinse the skin, because the skin becomes exquisitely sensitive while on Accutane and prone to dryness. Cleansers, no matter how gentle they are, will disrupt the moisture barrier even further, and that can just be really uncomfortable while you're on Accutane. It's not to say you can't use a gentle cleanser. Many people tolerate those just fine, especially for removing makeup. I have a video, as a side note, on skincare products I recommend for people on Accutane, so I will link that down below in the description box. But yeah, be very careful of over cleansing your face or your skin in general, because Accutane is going to affect all of your skin, not just the skin on your face, wherever you have acne. It's going to affect the skin all over. All right, so dry skin, dry eyes, dry lips. The other thing is the mucosa in your nose can become dry, you can become more vulnerable to nosebleeds. So another piece to this moisturizing aspect of things that I highly suggest is getting yourself a humidifier, especially to run at nighttime. This is gonna help with the dry skin, it's gonna help with the dry eyes, and if you're a mouth breather in particular, it will help with the dry mouth at nighttime, so definitely invest in that. They're inexpensive, and that can really go a long way as well, in addition to being mindful of your bathing practices and some of these other things. Artificial tears for the dry eyes is a must, in my opinion, and really, really helpful. Let's talk about the Jif peanut butter. Why did that peanut butter there? Are they wanting you to do a peanut butter face mask? No. I'm assuming they put it there because when you take Accutane pills, when you actually take the pill itself, you need to ingest it along with some sort of fatty food. Peanut butter is commonly suggested because it's affordable, generally speaking, and generally well liked, but it doesn't have to be peanut butter. I saw some comments on this thread, oh, I hate peanut butter, oh, I'm allergic to peanut butter. It doesn't have to be peanut butter. It can be any fatty food. It could be avocado, it could be ice cream, whole fat yogurt, it could be really any fatty food will help with the absorption. The reason this is so important, and I'm glad they have it on there, is that if you do not ingest the Accutane alongside some sort of fat, you will have suboptimal absorption. And this is a reason, actually, some people fail Accutane, is because they go along the entire course of their treatment, taking it either on an empty stomach or without any fat. They're getting suboptimal absorption and they never achieve the cumulative dose needed to treat their acne. So while it's really important that you actually ingest the pills with a fatty food to get good absorption, your diet overall, you want to be careful, is not super high in fat. For example, if you're somebody who eats McDonald's cheeseburgers and French fries every day, and then fried chicken and a lot of fried foods in particular, very high fat, you have to be careful because Accutane does increase your triglycerides. That is a very common side effect. That is something that we check when we monitor your blood while you're on this medication, is the triglycerides. It's a common blood abnormality while on Accutane. So if you have that blood abnormality, and then on top of that, you have a very high fat diet that also can increase your triglycerides, the triglycerides can end up getting too high, and that can actually be harmful for your pancreas. The I-40 pill they have floating in this collage is Accutane. I guess they just have that there representative. It's kind of confusing that they have it there because they don't explain that that is Accutane, and it kind of is right next to the tears. Like, I'm not sure why they put it there. It's a little confusing, just a critique for the way that the information is conveyed, but whatever. All right, and then we have a picture of Elta MD sunscreen. Looks like maybe clear or UV clear or UV daily. Anyways, over it they have SPF 99999, high SPF. All right, this is a great recommendation to have on the slide because when you are on Accutane, your skin becomes even more sensitive to the sun. And so you definitely need to be protecting your skin from the sun while on Accutane. I mean, you should be doing that anyway, but if you're somebody who typically has never had a sunburn before, you may find that your skin burns a lot more easily. So definitely protect your skin from the sun. Wear a broad spectrum sunscreen to all sun exposed surfaces. You guys know from my videos though that sunscreen is not a shield of armor, so I would also like to see added to this maybe a sun protective hat, UPF clothing like what I'm wearing here, just for additional measures. Sunscreen is not a shield of armor, and it's kind of difficult to keep up with it all over the body. So the behavior of sun protective clothing and sunscreen, plus avoiding being outdoors too long. And the other thing I would love to see on here is a picture of a tanning booth with a big X through it. Some people still engage in indoor tanning, very, very dangerous, regardless of if you are on Accutane or not, but definitely do not get in one of those things. I mean, don't get in one of those things at all, but definitely don't if you are on Accutane. It could be quite horrific for you and your skin. Do not get in one. Another thing they could put on here with an X through it is, a waxing kit. Because you don't want to wax while you're on Accutane, wax the hair as hair removal. It will cause erosions, it will pull off your skin. That sounds really terrifying, but it will pull off some of the top layer of your skin, because remember, Accutane is changing the top dead layer of your skin as well. It's thinning that. Very vulnerable to stripping with the wax, and you can develop sores. And while you're on Accutane, your healing, the skin healing is a little bit altered, and you can develop scarring. So no waxing while on Accutane. So we covered the fat, we covered the dry skin. The other thing I'm seeing on here is a few forms of birth control. We have a condom, we have an intrauterine device, otherwise known as an IUD, and we have what looks like a pack of birth control pills. And then underneath that, we have iPledge. What is iPledge, and why do they have all of this birth control there? iPledge is something that was instated in the US by the government in 2006 as a way to reduce fetal exposure to Accutane. Why? Well, Accutane, otherwise known as isotretinoin, I'm using them interchangeably here, sorry if it's confusing, is a teratogen. And what that means is that it will cause birth defects in a fetus if you become pregnant. Not it can cause birth defects, it will cause birth defects, severe life-threatening birth defects. And as a way to minimize fetal exposure to isotretinoin, basically making sure that anybody who can get pregnant will not get pregnant while they're on Accutane, the government instated this monitoring basically of any physician or healthcare provider, pharmacy, or patient distributing or receiving a Accutane prescription. This is a governmental regulation of the distribution of isotretinoin, basically a way to reduce, in theory, the fetal exposure to Accutane. What does it entail? It's most involved for women of childbearing age, basically any female who can get pregnant, because you have to go in monthly and you have to prove that you are not pregnant with a pregnancy test. So you have to prove that you're not pregnant once a month, and you have to verify that you are using not one, but 2 forms of birth control. And abstinence is one form of birth control that is allowed. Now, I want to make it crystal clear that while isotretinoin Accutane will cause birth defects if you get pregnant while you're taking it, it does not mean that it is going to screw up the chances that you get pregnant and have a healthy child in the future. Accutane, isotretinoin, stays in your system for approximately 30 days. So after you stop taking isotretinoin, you need to continue birth control, not, abstinence, birth control, whatever. You cannot get pregnant for another 2 months roughly, and then after that, you're fine. It's out of your system, it's a done deal. It's interesting because isotretinoin Accutane is regulated so heavily as a way to minimize fetal exposure to this drug, but there are other types of systemic vitamin A, like isotretinoin, that we prescribe for other conditions that stay in your system for years and years and years. You cannot get pregnant for years and years and years, if ever again, that are not regulated like this. It's really hard to say, actually, to what extent the iPledge program has been successful at reducing fetal exposure to isotretinoin. iPledge is a huge barrier, actually, for a lot of people getting their medication. And, to what extent it's actually reduced fetal exposure to the drug it's difficult to say, actually. But it really makes it hard, actually, for a lot of people of childbearing potential age, to get the drug, and it ends up being a barrier. And it also scares people away from the drug. There's a lot of fear mongering around Accutane, especially on the internet. So I'm glad to see this forum, or this is the first thing I've encountered from this thread. I'm not getting any like fear mongering from this. They're putting out, you know, reasonable information here. Okay, so we covered that. Then we've got this person here clenching their back with what, you know, the red kind of suggesting back pain. Yes, back pain is actually a pretty common reported symptom. It's not permanent. Back pain and muscle aches are really common in Accutane. We don't know entirely why this happens. The back pain may be due to the cells in the joints becoming more sensitive as a result of Accutane. Honestly, we don't have a good explanation for why people report this. And it's a lot more common in athletes, people who engage regularly in vigorous activity, runners, basketball players, you know, anybody working out is more likely to have this symptom, and it can be pretty uncomfortable and leave you feeling overall very fatigued too. Fatigue, muscle aches, joint pain, back pain in particular are common side effects, but they're not permanent, and it doesn't impact the health of your bones. I've gotten questions too, as a side note, does Accutane cause or put you at risk for osteoporosis? It does not. Vitamin A supplements, hypervitaminosis A, taking too much vitamin A can cause osteoporosis. Another oral vitamin A form, not Accutane, but etretinate, which goes by the name Soriatane, it has actually been reported to be in association with osteoporosis. But Accutane itself, isotretinoin, no, does not impact bone density. All right, and then the final thing I'm gonna chat with you guys about is a quote, in quotes, it says, can I really not drink on this? I'm assuming they mean alcohol. Can you not drink alcohol? And I think they put this on here because it sounds like, at least from the comments on this thread, that this is something people commonly post to this thread, a question that is commonly posted. And so rather than answering it, they just put the question there. All right, what is the answer? Can you drink alcohol while you are on Accutane, while you are on isotretinoin? It is not a good idea to drink excessively on any medication, especially Accutane or isotretinoin. Why? Well, isotretinoin and most medications, they're metabolized in your liver, and alcohol interferes with that metabolism. And so you can have impaired metabolism of any medications that you're taking if you consume alcohol in excess. If you have a glass of wine here and there, that would not cause me to worry about your health or anything like that. But if you binge drink, if you drink excessively, if you drink on a regular basis, like daily, then we're getting into a territory where it could potentially be harmful. The other reason to avoid alcohol is that it dries out your mouth even more. And that too can contribute to the dry mouth symptoms. So that's another reason to avoid alcohol. And then alcohol gets in the way of healing and recovery. So ultimately, it may end up having an effect on your ultimate end results, although that's kind of speculative. We don't have any long-term data on people who consumed alcohol in moderation while on Accutane, because we don't have studies like that. And then the other thing about Accutane is the liver enzymes in the beginning go up a little bit. Those are called transaminases. They increase a little bit. They increase in the first few weeks of starting Accutane, and then they actually come back down while you're still on the medication. So it's a temporary increase in those enzymes. But if you were drinking a lot and have that bump in the liver enzymes, that could be a period of time in particular where you're very vulnerable to potential liver damage. So I always tell people, lay off the alcohol while you're on this medication, mostly because I'm concerned about metabolism of the drug, any binge drinking. But if somebody comes in, they're like, oh my God, I had a glass of wine at this wedding the other week, and I've been reading online that I'm not supposed to drink, I'd say, you're fine. Specifically avoiding saying alcohol in moderation, because I have come to appreciate the fact that everyone's definition of moderation is variable, is their own. And for me, moderation, I don't even drink alcohol, but to me, moderation is a glass of wine 1 to 2 nights a week. But for other people, it's a couple of glasses of wine every day. And I don't think that's moderate. That's not moderate drinking. That's considerable drinking, maybe okay in your non-Accutane life, but while you're on the medication, that's probably too much. Could affect your liver, it could affect the metabolism of this drug. But I do think it's prudent to not drink alcohol while you're on it. But if you had a glass of wine here or there, don't lose sleep over that. You know, I know people get very anxious about things like this. You know, there's another medication that we frequently prescribe in dermatology called methotrexate. A lot of people have to be on that. You know, Accutane is only, 4 to 6 months that you're on it. And I know that can seem like a lifetime, especially when you're an adolescent. But when you get older, 4 to 6 months is like, oh wait, is it time for lunch yet? Yeah, I mean, it goes by fast. But other medications like methotrexate, as I was mentioning, people have to be on for a long period of time to control their disease. And that medication definitely can impact your liver health. And we tell people to avoid consuming alcohol in excess. But even that medication, if a patient comes in and they're like, I really want to have a glass of wine on my anniversary, is that okay? Yeah, it's fine. Just don't make this a daily multiple glasses thing. Then it can get dangerous. So always have the conversation with your doctor about what's going to be right for you. If you're thinking about talking to your doctor about going on this medication or having your child go on this medication, definitely make sure you have all of your questions answered. Your physician, healthcare provider should be enthusiastic about providing you as much education as possible, but some things we're not going to think to tell you unless you ask. Any concern that you have, we're going to tell you the main things to be mindful of. But if you have a worry in the back of your mind about something, ask, because it's better to be informed. And what can end up happening, unfortunately, and happens a lot, is that people don't ask questions to their provider, to their doctor, and they go on these websites, they find some of this misinformation, they get scared about it, maybe they're intimidated to actually ask their doctor, so they just stop taking the medication. And then of course it fails because you didn't achieve the dose that you needed to. So don't be afraid to ask your doctor these questions and get answers, especially if you read something on the internet. Like, I'm actually pretty pleased by this collage overall because they're highlighting true common side effects, things to be aware of, but they're not fear-mongering. They're not, putting out misinformation. So good on this Reddit subforum for this overall. I really, I'm glad to see that because I have seen some really, scary type posts that make people fearful. Yeah, historically, Accutane has gotten horrific press. It's a great drug. It can and does cure acne for many people. And the reason that's important is because untreated acne will go on to scar, and that will affect you for your life. Emotionally, it really has a huge impact. Speaking of mental health, I recently did a video addressing a misconception about retinol and depression. I talk about Accutane and the association with depression. I know that is something that people are really worried about. How is it going to impact my mental health? I talk about common misconceptions in that video. Make sure you check that out. It will be on the next slide. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.